Hi, I'm Christy. I want to talk to you today about therapy and how that can help once you've received a diagnosis. I should remind you that I'm not a medical professional. This is not meant to treat or diagnose. It is for informational purposes only. Now, this can be a very exhaustive list, and so I'm going to just hit some of the main types here. The first one I want to talk about is PT, or physical therapy. This one's pretty common. You've probably heard about it. PT deals specifically with gross motor or large muscle movements. It can improve strength and flexibility, and it works with things like going up and down stairs or how to ride a bike, those kinds of issues. A second type is OT, or occupational therapy. Again, this one's pretty common. You've probably heard about it. It deals specifically with fine motor or small muscle movements. Things like handwriting, pinching, eating or self-feeding, transferring objects from one place to another. It can also deal with sensory issues and teach some coping skills. The third type is speech therapy, and I've heard this described as anything above the neck. So this can be feeding issues like what's a good bite size, how to chew well, how to swallow, those kinds of issues, as well as dealing with actual speech. The actual speech can be how a person produces speech, as well as what they're understanding as they're spoken to. The fourth kind would be hippotherapy. Now this one's a little less common. This is where a horse is used as a tool in therapy. So it can be used for PT, OT, or for speech, and the horse is used, the movement of the horse is used to help improve or to help assist the person through their therapy session. Now they usually have 3 people involved with the person. There's 2 people walking on each side, making sure they keep their balance and stay on the horse safely, and then there's 1 person directing the horse. And usually one of the people walking beside will be the actual therapist who's directing the session. And I do need to point out this is not the same as therapeutic riding, which some people with special needs will use, and it is definitely not the same as just regular horseback riding. A fifth option would be medications. These can be both prescriptions and natural supplements. Very personal opinion here and personal preference, but they can be very beneficial. The last area I want to talk about is that of counseling or a mental health assistance. This can be really good if you've had major traumas or if there are mental health issues involved. They can help teach coping skills. I do recommend that you find a licensed counselor with experience specifically in your area. From our personal experience, my oldest son has had PT, OT, speech therapies, as well as hippotherapy. And over the years, we have done supplements and some prescriptions. And I believe all of these things have helped him gain skills and abilities that he has today that still make, or that improve his life today. I do also need to point out that therapy does not cure a diagnosis. It does help improve quality of life, and it can make life a little bit easier to get through a day. As I mentioned before, this is not an exhaustive list. That list would be incredibly long. I do recommend that you talk to the medical professionals in your life and see what they recommend and where they recommend that you start to find the help that you would need for your loved one. I would love to hear comments below from you as to things that you've tried, questions you have, those kinds of things, and I will do my best to answer them. And as we wrap this up, I hope that you've been reminded and that you can agree with me that life is good. And there is never a dull moment.